important that even within the context of us discussing the broad implications of the credit crisis for Africa, I think the most profound impact of this international crisis is going to be on Africa's poor, and issues of healthcare, food security and social justice have featured quite prominently on the agenda this year. But how much of an influence is it having on leaders and how they deliberate issues of society and poverty?
We hope that it will have an effect in terms of having these issues on the agenda here in terms of health and agriculture, because as you rightfully said, that's who's going to be affected dramatically by the impact of the financial crisis on the continent. Whether it's issues of food security and the number of people who will go hungry this year increasing in the tens of millions, to the issues of health care, which will also be affected both by countries' budgets on the continent as well as donor budgets coming into the continent.
Now, this morning when we woke up, there was a civil society protest outside of the haloed halls of the International Convention Center, and it's people protesting that the question of HIV and AIDS must be given preeminence at the summit. And HIV and AIDS and healthcare forms the bulk of the work that you do in the foundation. How important is it, do you think, for WEF leaders to address this one?
We have always thought, and this is one of the first things when the foundation is engaged with WEF, that the health issues need to be a priority for WEF in terms of all the players, whether they're government players, private sector players, or philanthropic players. And when one thinks about health and also the issues of agriculture, which influence people's incomes that also play into their health, both are essential issues that we think need to be a part of the discussion.
And also agriculture and health have the direct correlation of nutrition and the ability to treat a lot of these diseases. Now, here's the dilemma. In South Africa alone, which is said to have the highest HIV infection rates and the highest HIV prevalence rates, the government has injected a lot of money and resources into it, almost $1 billion US, and yet we are not getting to the nub of treating this problem. Why is it we throw money at a problem but we're not getting the results?
I think the question is what type of results, as one thinks about. There are different issues in terms of prevention and issues in terms of treatment. And the questions of death rates and that sort of thing are things that I think are being affected by the funding that the South African government has put against the issue. And the question of prevention, I think, is something we need to redouble our efforts. At the foundation, we believe it's very important to do the research for an HIV/AIDS vaccine, which will be the type of thing that will do real prevention. But there are other methods of prevention. Circumcision actually is a proven method now of prevention that the WHO will probably soon be endorsing.
I know you're very active in parts of East Africa, for instance, and that's where some of the more innovative programs have been undertaken. Do you want to tell us about your work there?
Yes, in East Africa we do quite a bit of health work as well as agriculture work, and some of our agriculture work includes a partnership with the World Food Program, which is the largest purchaser of staple crops on the continent of Africa. And what we're trying to do is encourage them through transforming their procurement processes to buy from the small farmer. And last month, 45 metric tons of rice were purchased from small farmers in Kisumu, Kenya.
Okay, here's the issue though. I mean, nobody's going to doubt the philanthropic elements and the goodness of the work that you do, but we're also told that NGO work is a business in itself, a business that amounts to something like $30 billion US per annum in salaries, in programs, in humanitarian aid, and we're trying to get Africa to a place of self-sufficiency in agriculture, in managing healthcare, in managing resources. How do we still work actively with organizations like the Bill and Melinda Gates Foundation and still empower Africans to a point where we're not needing these aid flows that sustain so many African countries?
Absolutely, and that's why a program like the World Food Program, or a program we're working with an organization called TechnoScurb that's helping coffee farmers in East Africa get both the inputs they need as well as the processes to process the coffee and then connect them to markets. Once that's done, this will stand on its own, and farmers will stand on their own with doubled income from premium prices from coffee. We're already seeing the results in Rwanda of that, and then once that has started, they'll stand, and it will be a commercial effort that small farmers will have on their own.